Sennosides are a type of medication that are commonly used to help relieve constipation. They can also be used to help cleanse the intestines before a bowel examination or surgery. Sennosides are classified as stimulant laxatives, which means they work by helping to retain water in the intestines, ultimately promoting movement of the bowels. It is important to follow the recommended dosage instructions provided by your healthcare provider. Sennosides are typically taken before bedtime to ensure a bowel movement in the morning. Always consult with your doctor before starting any new medication. To take Sennosides, you can either chew the tablets, let the dissolving strips dissolve on your tongue, or measure the liquid form with a special measuring device. Do not use a household spoon. The dosage will depend on your age, medical condition, and response to treatment. Do not take this medication for more than 7 days unless directed by your doctor. It may take 6 to 12 hours before this medication causes a bowel movement. If your condition lasts or gets worse, or if bleeding from the rectum occurs, seek medical help immediately. Some common side effects of Sennosides include stomach or abdominal pain, cramping, nausea, diarrhea, and weakness. If these effects persist or worsen, it's important to contact your doctor or pharmacist. Sennosides may cause your urine to turn reddish-brown, but this is a harmless effect that will go away once you stop taking the medication. If your doctor has prescribed Sennosides for you, it's because they believe the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. However, it's important to seek medical help if you experience serious side effects such as persistent nausea, vomiting, diarrhea, muscle cramps, irregular heartbeat, dizziness, decreased urination, or changes in mental/mood. While rare, a serious allergic reaction to Sennosides can occur. Seek immediate medical attention if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. As for the daily dosage and optimal timing, it's best to follow your doctor's instructions. If you have any concerns or questions about Sennosides, don't hesitate to ask your healthcare provider for more information. Before taking Sennosides, make sure to tell your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to let them know about your medical history, especially if you have had appendicitis, sudden changes in bowel habits, or intestinal blockage. If you are diabetic or pregnant, it's important to consult with your doctor before using this medication. Additionally, if you are breastfeeding, be sure to speak with your doctor before taking Sennosides. As always, it's best to consult with a healthcare professional to determine the best dosage and timing for taking this medication. When taking Sennosides, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Sennosides and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center. Symptoms of overdose may include ongoing nausea, vomiting, or diarrhea, as well as severe stomach pain or cramping. Remember to keep all of your medical and lab appointments. If you're experiencing constipation, there are some lifestyle changes that might help, such as exercising, staying hydrated, and eating a diet rich in fiber from foods like bran, fresh fruits, and vegetables. Make sure to consult with your doctor or pharmacist about any lifestyle changes that could benefit you. If your doctor has prescribed Sennosides for you to take on a regular basis, it's important to take it exactly as directed. If you happen to miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and take the next dose at the usual time. It's crucial not to take a double dose to make up for the missed one. Sennosides are typically used to treat constipation and are usually taken before bedtime to produce a bowel movement the next morning. It's important to drink plenty of fluids while taking Sennosides to help prevent dehydration and to follow a healthy diet with an adequate amount of fiber. The recommended dosage of Sennosides can vary depending on the individual and their specific condition, so it's best to follow your doctor's instructions. Always consult with your doctor before starting any new medication or changing your current regimen. When it comes to storing Sennosides, it's important to follow the specific instructions on the product package or ask your pharmacist for guidance. Keep all medications out of reach of children and pets. It's also crucial not to flush Sennosides down the toilet or pour them into a drain unless directed to do so. When Sennosides are expired or no longer needed, make sure to dispose of them properly. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.